Mental health is an integral part of overall well-being, yet psychological disorders remain one of the most misunderstood areas of healthcare. Today, we're diving deep into the frameworks used to understand and treat psychological disorders, including the biomedical and biopsychosocial approaches, therapy types, and the essential role of the DSM in diagnosis. The biomedical approach to psychological disorders focuses exclusively on biological disturbances. This includes chemical imbalances in the brain, genetic predispositions, and structural abnormalities. From this perspective, psychological disorders are seen as illnesses that can be treated with medical interventions, much like physical ailments. For example, in depression, low serotonin levels may prompt the prescription of selective serotonin reuptake inhibitors, or SSRIs, to restore balance. Similarly, antipsychotic medications target dopamine dysregulation in disorders like schizophrenia. While this approach has revolutionized the treatment of many conditions, it has limitations. By focusing solely on biological factors, it often overlooks the psychological and social contributors to mental health. Enter the biopsychosocial approach, which expands our understanding of psychological disorders by integrating three critical components: biological, psychological, and social factors. This approach recognizes that mental health isn't just about brain chemistry. It's also about how we think, feel, and interact with the world. For example, let's consider anxiety. While overactivation of the amygdala, a biological factor, may predispose someone to anxiety, cognitive distortions like catastrophizing, a psychological factor, and living in a high-stress environment, a social factor, can amplify symptoms. The biopsychosocial approach provides a roadmap for tailored, multifaceted treatment plans that address the individual as a whole. Treatment for psychological disorders often involves two complementary methods: direct therapy and indirect therapy. Direct therapy acts directly on the individual and includes methods like medication, psychotherapy, or cognitive behavioral therapy. For instance, someone with severe depression might combine antidepressant medication with regular sessions with a therapist. Indirect therapy, on the other hand, focuses on increasing the individual's support system by educating and empowering their family and friends. This might involve family therapy sessions, workshops, or support groups aimed at creating a nurturing environment for recovery. These two approaches often work best in tandem, offering individuals the tools they need to manage their symptoms while fostering a network of support. Understanding psychological disorders wouldn't be complete without discussing the Diagnostic and Statistical Manual of Mental Disorders, or DSM. The DSM provides a comprehensive classification system for diagnosing mental health conditions. Currently in its 5th edition, the DSM includes 20 diagnostic classes and serves as a common language for mental health professionals worldwide. It's organized by symptom descriptions rather than underlying causes, enabling accurate and standardized diagnoses. For example, to diagnose major depressive disorder, clinicians use DSM criteria like persistent low mood, lack of energy, and loss of interest in activities over at least 2 weeks. However, the DSM isn't perfect. Critics argue that it sometimes oversimplifies complex conditions and risks pathologizing normal variations in behavior. Despite these criticisms, it remains an invaluable tool for guiding treatment and advancing research. Let's bring this all together with a case study. Meet James, a 28-year-old diagnosed with generalized anxiety disorder. His symptoms include constant worry, restlessness, and trouble sleeping. A biomedical approach might prescribe an anti-anxiety medication like a benzodiazepine to alleviate his symptoms, but James's therapist also recognizes the importance of a biopsychosocial approach. Together, they identify cognitive distortions fueling his anxiety and stressors in his work environment. Direct therapy helps James develop coping mechanisms through cognitive behavioral therapy, while indirect therapy involves educating his family about his condition and encouraging open communication at home. On the MCAT, questions about psychological disorders often test your ability to analyze scenarios using these frameworks. You might be asked to identify whether a treatment plan aligns with the biomedical or biopsychosocial approach, or to evaluate the effectiveness of direct versus indirect therapy. Practice recognizing these distinctions in case studies and experiments. Understanding how the DSM categorizes disorders and how therapies are applied will give you a significant edge on test day. To recap, the biomedical approach focuses on biological factors and medical interventions, while the biopsychosocial approach considers the interplay of biological, psychological, and social components. Effective treatment often combines direct therapy, like medication and counseling, with indirect therapy. The DSM serves as the gold standard for diagnosing mental health conditions, despite its limitations. Understanding psychological disorders is not just about memorizing theories. It's about appreciating the complexity of mental health and the importance of tailored, compassionate care. Thank you for joining us on this journey through the foundations of psychological disorders. To access more resources and master your MCAT prep, visit kotc.me and explore everything King of the Curve has to offer. Together, let's tackle the curve and achieve your goals.